Hi everyone. So what I thought I'd do for you today is to walk you guys through some of the basic information on back pain. So it's what we call normative data. Now, the reason I want to do this is because this is what I do with all of my patients. When they start care, we sit them down and we go through the normative data so that they understand what back pain is and what it isn't. Because there's lots of different opinions and it's still quite grey really if we try and define what back pain is. So the best way to get a clear idea of where we're going to go and what everything means for yourself is to be confident on what we know back pain isn't. Another reason that we do this with people is because we know that when they fully understand all of this information, they do better long term. So you being in control of more information, it's that whole kind of knowledge is power kind of adage. So what I want to do is walk you through that today. Now, a lot of people don't know, but back pain actually affects 80% of people at least once in their lifetime. So 8 out of every 10 people that you see when you're walking down the street, they will get an acute, a short-term episode of back pain at least once during their lifetime. So the thing I want you to take from that is to know that back pain is very, very normal. If anything, you're weird and different if you're within that 20% of people. So back pain is a normal part of human everyday life. Don't sweat it if you have one of these episodes. We know that about 80% of the 80% see a resolution of their symptoms in around 2 to 6 weeks. So pretty much everybody gets better from that initial episode within 2 to 6 weeks, provided that you do all of the things you're supposed to. So that would be things like staying active, try and stay normal everyday life, so things like work. Sometimes you've got to chat to your boss and see if you can change your activities at work if you're finding that things are particularly aggravating. But what we want to do is make sure that you just live life as normally as possible, but try to not aggravate that pain every day. So that's something that we talk quite a lot about. Be normal, be active, but don't keep pissing it off, basically. About 20% of people, so we have 8% of people will get better in around 2 to 6 weeks. 20% of people find that their pain actually can last longer than 12 weeks. Now that's what we call chronic pain. It's slightly different to acute pain. So acute pain is anything up to 12 weeks. So that is a normal tissue healing time. That's why we call it acute pain, because within 12 weeks, you've probably got some tissue damage that is healing. When you go past 12 weeks, that's what we call chronic pain, and that's not associated with tissue damage. That's associated with what we call nervous system sensitivity. So sensitivity in how your nervous system is functioning and perceiving movements. That's working in a faulty way, and that's the main thing that's driving your symptom at that point if you're part of that 20% and you've got pain for more than 12 weeks. We don't really know why that 20% of people go from having acute pain to having chronic pain. There's several different factors that a study from a really, really high quality study from a couple of years ago called the Lancet back pain series. That study picked out a few factors that they believe to be correlated with people going from having acute to having chronic pain, and that includes initial high pain intensity, psychological distress, and also then having pain in multiple different sites around your body at the same time as having your back pain episode means that you're more likely to go from that acute to chronic. Now, I mentioned before that about 80% of people will get better within 2 to 6 weeks. So most people get better in that initial time frame. Of that group of people, about 30% of them will have another episode within 1 year, within 12 months. So about 1 in every 3 people who gets back pain will have another episode again within 12 months. So it's kind of a high recurrence rate, but in our opinion, that depends on what you learn from your experience. If you don't learn anything about back pain or how to manage your lifestyle or your health, then in my opinion, you're probably more likely to be in that 1 in 3. But if we can change some of your risk factors for getting your back pain, then in my opinion, we can bring that risk down a little bit. The thing to bear in mind is that with back pain recovery, a lot of people recover. So as I said, it's about 80%, but there's less people that then just stay better. And even more people have kind of a wobble along the way, if you like. So a lot of people will have good days and bad days as you're coming to a complete resolution. So the guidelines in the UK state that the two best treatment options in that acute phase, so within 12 weeks, are education and to remain active. Those are the two things you need to know. So one thing to interpret that into our programs, what we do is we sit down with people and we make sure that they're fully understanding what back pain is, what it isn't, and what they need to be doing going forward. So that's the education part. Staying active bit is easy. So that's what I talked about earlier. So that's just keeping life as normal as possible. Don't just sit around and wait for the pain to go away. So the reason that we say you got to stay and work is because we actually know that the longer you're out of work, the less likely you are to go back to work. So it's really, really important to stay in there. If you do find that there's certain jobs around work that are really aggravating your back pain, then have a chat with your boss and see if you can modify. I know that I've done that with a number of patients in the past. They've had particularly active jobs, done lots of lifting and loads of walking during the day, and they found that was just too much early on when they'd hurt their back. So we had a chat with their boss and we got them to bring those activity levels down a little bit. You could even do a phased return to work, so just do 1 day a week and build it up, or you could just be moved onto slightly different job roles perhaps, but that would be for you to have a chat with your boss about. Now, I mentioned before about if we want to really try and keep your risk of back pain as low as possible in the future, you've got to tackle the risk factors. Now, the reason I say that is because 90% of back pain, so 9 out of 10 people's back pain, does not have a single underlying cause. It has multiple underlying causes. So that's what we call it multifactorial, or you may have heard the word non-specific before. So there's not a specific cause. There's lots of little things. So for ourselves, with our patients, we use the phrase death by 1,000 cuts. You've got back pain from multiple smaller factors. Now, those multiple smaller factors might include low activity levels, poor quality or quantity of sleep, being overweight, or smoking. Those are a few. There are other factors that are involved, but those are 4 of the ones that I tend to approach with people most commonly. I actually had a patient not that long ago who was a taxi driver, and he had been for a period of time he'd moved to working nights, so his activity level came down, his quality and quantity of sleep decreased significantly, and he was overweight. So you've got 3 risk factors there, and that was something that we're tackling with him to drive that long-term result in terms of getting rid of his back pain. Now, as I said, 90% of all back pain has no specific cause, but there are some that does have a specific cause. So that's about 5%, around about 5%, around about 5%. Now that has a specific structural cause. So that could be like what we call a spondylolisthesis, where the vertebrae don't quite line up on top. They're just kind of one's out of alignment there. There could also be something like a fracture. Now, less than 5% is due to what we call pathology. So that might be something like a bone infection. Less than 1% is due to really nasty stuff, and that less than 1% is the thing that requires urgent medical attention. So that's only 1 in every 100 back pain cases. The reason this means that 9 out of 10 people, they can do really, really well with care that helps to manage those individual factors, making changes on those. That's where they can do well, and they can move forward. We've seen so many people who are in that 90% who've seen somebody else previously who were told that they did have a single underlying cause. So that includes stuff like they said that this patient a patient told me recently they had a weak core and that was why they had back pain, or that they'd slipped a disc, or that their pelvis was out of alignment. And I mean, I don't want you to make a mistake. I'm definitely on your side, but those explanations for those patients are horrendously scientifically inaccurate. And what that leads people to do is to go down the wrong avenue for treatment, and you end up having a treatment that's ineffective. So if a patient had a weak core, they just spend loads and loads of time trying to strengthen their core. I've mentioned it before, but having a weak core is not a predisposing factor for back pain. Exercising your core when you have back pain can help to get rid of it faster, but having a weak core is very, very loosely, if at all, related to getting episodes of back pain. So by me being able to communicate that to a patient, we can get a better, more effective treatment for that patient. So again, we need to make sure that you guys fully understand that 9 out of 10 people have back pain that's from lots of different little things. So again, a weak core could be a factor in that, but again, there's going to be loads of other little things that are more related to pain. So I've done loads and loads of talking. There's loads of stats in there. Make sure you go back and watch this video again, because watching it once is definitely not going to be enough. Be reassured by the fact that you can definitely make positive changes once you're in possession of useful, accurate information. 90% of all back pain is from all of those little factors that are involved within our lifestyle, and they're things that are actually under our control. So we can positively influence our back pain without having to spend loads of money on tests and x-rays and MRIs and blood tests and things like that. What we do is we sit down with people and we go through, as part of our consultation, we help them to identify the factors that are involved for them, and then we show them how they need to change that, and that is what drives long-term results. Lots of different types of treatment can create pockets of improvement, short-term stuff, but really getting into those risk factors is where your long-term improvement comes from. So, as I said, make sure you go back and watch this video again. Drop us a comment and tell me what you would like us to do for you next. Enjoy all the stuff on the page, and we'll speak again soon.